Welcome to the Laser and Skin Surgery Center of New York webinar with Dr. Murphy-Rose. I'm very excited to have her today. She's going to be speaking on jawline and neck contouring. Now, all of our prestigious physicians, dermatologists, and plastic surgeons offer a number of these procedures that we'll be speaking about today. And Dr. Murphy-Rose, in case you're not familiar with her, it's because she only recently joined our practice this year. So we're really excited to have her. She sees patients primarily in our Manhattan location, but she also sees patients one day a week in our Southampton office, usually on Mondays. So Dr. Murphy-Rose is a board certified dermatologist. She does a lot of medical and cosmetic services. So that means she does accept insurance for her medical services. And for cosmetic, it's mostly injectables and lasers and body contouring, including the neck and jawline area. So you are definitely in good hands. And if she looks familiar, it may be because you've seen her in national media outlets. She's been in many magazines from Vogue to Cosmopolitan, and she's on the news. She publishes peer-reviewed journal articles. And although she was born in New York City and she grew up in California, but is now back practicing in New York City, and we're very lucky to have her. So without further ado, Dr. Murphy-Rose, the floor is yours.
Thank you. Thank you. Hello. I'm very excited to have you all here to talk about jawline and neck contouring. We are going to focus on non-surgical, non-invasive procedures that are available to you, of which there are many. Just like Reese has said, I am a board certified dermatologist, newly joined in the spring here at Laser and Skin Surgery Center of New York. And I'm also a clinical instructor of dermatology at the New York Presbyterian Hospital, Weill Cornell Medical College. And let's just get to it. So just a quick overview. We're going to talk about a question that many of my patients ask. In fact, friends and family members and, people at the park where I'm taking care of my kid will say, why is my face falling? And sort of talk about the aging face. We'll touch on aesthetic ideals. I hate to talk about true ideals because we all have our individual face and that makes the world a beautiful place. But there are some ideals we'll just touch on. Then we'll talk about all these procedures that are available to correct or improve, the contour of the neck and jawline. So these non-invasive office procedures include tightening technology. So we'll talk about ultrasound, radio frequency, and lasers or CO2 lasers. Talk about injectables, things like Botox and Dysport and other neuromodulators in that family. Dermal fillers and also thread lifts. And then lastly, we'll go and talk about the fat fighters, I'm calling them. So Kybella and CoolSculpting that can help to dissolve fat. Why is my face falling? So over time, you see the progression from 20s to 60s or potentially even 80s here. We see a significant difference. And a lot of that is due to two main things. One is an increase in the skin laxity or the looseness. This happens primarily because we have a loss of collagen and elastin in the skin. It's thought that we lose about 1% of a collagen every year after we're born. Collagen and elastin are both proteins that occur in the skin. In fact, collagen is the most abundant protein in our bodies. You can think of it as sort of the building block or a building protein that keeps things in its place. So it keeps the skin where we want it. And then elastin is just like the name sounds. It gives sort of an elastic quality to our skin or the tissues that it is in, of which there are many. And it's the elastin that helps you, say, if you were to pinch your skin or push on your skin, you're able to retain the normal tissue. It'll kind of bounce back because of the elastin. And so when we have a loss of collagen and elastin, as you can imagine, the skin loses, all that sort of suppleness and it starts to droop or follow gravity. We also we get a decreased capacity to retain water, which also contributes to the aging skin findings. And then the volume loss is important to talk about when we talk about the aging face. So here we have a little diagram of a scaffolding. The scaffolding is very important. Even if your skin is of a nice quality, if you have a poor scaffolding or structure beneath the skin, you're going to see some of those signs of aging, things like shadow formation or folds of the skin, wrinkles, and so forth. So with volume loss, two main things are happening there. One is that we have a fat loss and fat herniation, or movement of the fat pads from where we want them, usually to lower areas, and we'll talk about that more in just a moment. And then we get bony resorption. This actually starts at age 25 for most people. There are some genetic differences, and for most people, it's really significant by age 35, where we actually see visual changes in the face or in the neck because of that resorption of bone. So here you see on your left, age 35, this model has fat pads that are really, tightly up north, right under the eye and so forth. And the fat pads are closer together. There's less spacing between them. And then as time goes on over the decades, with just aging, sun exposure, things like smoking can contribute significantly. We see those fat pads heading south and spacing out more. And then here's on the left, it's an inverted triangle of youth. So just sort of another way of describing that, where we see the fat pads higher up and more of like a heart-shaped face. And then as this woman ages, that triangle flips upside down, sort of up, right side up. And then a lot more of the fullness is down towards the jawline and the neck. And then here, just a male example, the same thing. So what is the ideal neck and jawline? Well, importantly, the jawline has a profound effect on the appearance of one's face and neck. And the ideal, or the youthful neck, is a jawline that is well defined. For men, the stronger jawline typically is more ideal. And for a woman, a delicate but yet still very defined jawline is ideal. There are differences so again, individual preferences. There are quote masculine and quote feminine ideals. The more masculine features for the neck and jawline are, like we said, a sort of a stronger jawline, and then a chin that's a little bit wider, typically the width of the inner eye, or we call it the medial canthi. And then for a woman, a slightly less wide chin that corresponds more to the nasal ala. As we get older, or even just with, even young people can have a genetic anatomical variation where we see like a jeck. So a blending of the neck and the jaw, which is perceived as less youthful, less desirable. And then of course, the overlying skin has a big impact. We want to see that smooth, lacking banding or lines, and with a well-hydrated, plump quality. So here we see the aged lower face and neck. There is an indistinct border of the mandible that that she probably didn't have many decades ago. And that is just what we're talking about, this quote jeck, or a blending of the jaw and the neck. She has increased laxity and looseness to her skin, sort of a crepiness has come over. And then a blunting of the cervicomental angle. I don't know if you all can see me, but if I turn, the cervicomental angle is this point from the chin that meets the cervical spine, and a more acute angle closer to a right angle is considered more youthful, more ideal. And then the blunting is as that angle widens. She's got some jowling that's occurring around the mouth. That's from those fat pads sinking down. A flattening of the chin from some of the bony resorption. As we age, that chin becomes smaller, gives less of a good scaffold for the skin to be pulled back tight. So, and we'll talk more about how to correct that sort of thing. And then prominent platysmal bands occur. We'll talk about this muscle, a thin muscle that kind of spans the neck, called the platysma. It interdigitates with some of the muscles on the lower face, right around the mouth, and it can actually pull down on the skin and pull down on some of those soft tissues, increasing that look of aging. And then not depicted here, but submental fullness is something we'll talk about, some of the unwanted fat that can occur, and then horizontal necklines, which is an issue I hear about a lot. And if you maybe patients complain about sort of the tech neck that can sort of contribute to some of these horizontal lines. All right, enough about that. We're here to talk about how we can fix this. What sort of corrections can we make? And so we have multiple modalities to improve this. At the laser and skin surgery, we have over 100 devices, and we get the latest and greatest technology to be able to share with our patients. The goal, of course, is to make you look and feel like the best version of yourself. All right, so non-invasive, non-surgical neck and jawline contouring. I've broken this up into 3 little groups. We'll talk about tightening technology first, so ultrasound, radio frequency, and laser technology. There are many a few ultrasound devices. My absolute favorite is Sofwave, so we will spotlight that today. Ultherapy, which gained FDA approval back in 2009, is also still widely used, and we do that in our office as well. Both of them, we see some incredible results. But in general, we're using these sound waves. They're high intensity, high frequency sound waves that we direct right where we want it. And so with the Sofwave, this brand new device, new to us this year, is, the office was part of the early research and development of this product. So we know it very, very well and have seen incredible results. We use these sound waves to heat the collagen. This is at 1.5 millimeters depth to the skin. And it causes this true directional tissue remodeling where we're actually able to tighten and lift tissues. Causes a very powerful activation of collagen production. We talked about how the collagen is very important to keeping our skin nice and youthful. And this can stimulate that production that without a procedure to kind of activate the collagen formation is just going to continue diminishing over time. This procedure is fascinating in that it has virtually no downtime. So there are not many devices out there where you can really get such a significant result with no downtime. The patients you typically leave looking completely the same. Right during the procedure, you have a little bit of redness or pinkness that occurs in the treatment area. By the time patients have left 5 to 10 minutes after the procedure is over, everything looks just the same, and you can go about your day just as desired. Advantages over the prior ultrasound device like Ultherapy is that this is a faster procedure. The handpiece has 7 transducers, so we're able to treat a bigger space per zap, if you will, and reduce discomfort. We found that going down to the depth of 1.5 millimeters is really an ideal place to stimulate that collagen production. And the heat, as you can see here in the diagram, this is a little biopsy of the skin. So the transducers are creating a little bit of injury into the tissue, and the natural healing process will stimulate collagen to form. And here you see in the biopsy a little area of coagulation showing that there is a true effect there. This is a patient undergoing Sofwave. Patients will come in, we'll put a topical anesthetic on that stays on for about 45 minutes. Afterwards, we'll remove the numbing cream and put on some ultrasound gel that helps the sound waves to conduct and undergo the treatment. And she's also holding a little cooling device. Sometimes we will use that as well if patients like. Some results before and after of ultrasound tightening. You see that significant improvement in the skin quality and a true lifting of the tissues. Again, same example, the improvements to the neck and jawline there. And then some tissue around the mouth. All right, so let's talk about radio frequency. So with radio frequency, we are also going to get a similar effect in the sense that we're using some energy to heat up tissues. That heating induces a coagulation and sort of this injury that then stimulates a powerful induction or activation of collagen formation. So my favorite of these is the Genius by Lutronic. The radio frequency, there are 2 different types. There are actually many different devices, but 2 big categories. One is radio frequency microneedling, and the other is without microneedling. One of those older devices was a Thermage. But with radiofrequency microneedling, we get a tightening and a resurfacing. So you do have some epidermal or superficial effects. Going back just a moment to the ultrasound, ultrasound is really excellent. It's very, very safe. It's safe for all skin types. You can use it on very dark skin types with some resurfacing procedures that affect the surface of the skin. We are limited in that, but with the ultrasound that's going nice and deep, we do not have to. And then radiofrequency microneedling, we use this handpiece that's got teeny tiny little needles that are going to penetrate the skin. These are gold-plated insulated needles. They target and cause, the heat injury, just similar to ultrasound, down exactly where we want it, protects the surface of the skin. And then again, this coagulation leads to collagen production and tightening. And then we get with the microneedle. With the microneedling, we also get some epidermal effects. So improvements in texture and tone. We can treat not only laxity, but scars and acne scars. And so this is actually a really great device for darker skin types that that wouldn't be a candidate, say, for Fraxel, which we'll talk about more later, but able to treat scars and acne scars in those types of, and those issues. And then here we have just this little depiction showing the radiofrequency energy affecting this gel sample. So in photo 1, there is the needle or the handpiece is just entering the gel. In the picture 2, it has just activated and left its thermal injury. And then in 3, the needles are up and you see that injury is still there. So this is where it would be, deep into the dermis where we want to activate some production of collagen. And then lastly, we'll talk a little bit about laser resurfacing. So fractional laser resurfacing is very, very popular. In fact, it's probably one of the most commonly performed procedures in our office. There are many different lasers. The most well-known and most popular that we use is the Fraxel Restore Dual and then the Fraxel Repair. These are excellent for skin resurfacing and remodeling. They also induce some injury into the dermis that then stimulates the boosting of collagen to varying degrees. It also has some epidermal effects. So reducing hyperpigmentation, some sun damage. We can use lasers like this for melasma and other sorts of brown spots. It improves the tone and the texture. You can reduce fine lines and wrinkles, remodel scars. And importantly, we can also reduce precancerous skin lesions. So there's something called an actinic keratosis that is considered a precancer. They are incredibly common. Most of my patients that I see above, say, age 40 have at least one, and in fact, many, several. So incredibly common. Only 2% turn into a skin cancer, and that's a squamous cell skin cancer, which is also a treatable skin cancer. But to be able to reduce a lot of those actinic keratoses is really wonderful. And then this is just a before and after of a great treatment with the fractional laser resurfacing. So let's switch gears and talk about all of the incredible injectables that we have to work on the neck and jawline. We'll start with neuromodulators. Botox was the first used here in the United States and the most, well-known. We use it all the time for the forehead. It's most well-known for forehead wrinkles, but we actually can use it, and we do, for the jawline and neck, and we get some really wonderful benefits from Botox. So for jawline contouring, here you see some before and afters of treatment to the masseter muscle. The masseter is this big muscle in the back of the jaw that helps us to chew and grind. But if it's overused, which it is on many, in fact, 70% of Americans clench. If we overuse that muscle, it causes some hypertrophy or enlargement of the muscle that can affect the shape of the jawline and affect the shape of the face. So if you see the before and afters, you may see the big difference between, once we've relaxed that hypertrophied muscle, it slims the jawline and creates a more proportioned face, kind of switching from a square or boxy shape to a more desirable heart-shaped face there. When I treat, I do about 2 to 3 injections per side. The Botox starts working at 3 days and it completely sets in by about 1 to 2 weeks. And at that point, because you're not overusing the muscle and it's starting to relax, the hypertrophy or the enlargement of the muscle is going to start to improve. And so we see that improvement usually starting about 4 weeks, and it just continues to improve from there. No loss of function to the muscle if performed correctly, and but just an improvement. And these patients that clench a lot and have hypertrophy, often along with that goes some temporomandibular joint disorder or TMJ pain, which is very, very common. And so by relaxing the muscles, we're able to significantly improve symptoms. This can be a real big, quality of life improver for many, many patients. And then we can also use Botox on the neck for neck contouring. And the two main ways we do this is, we inject Botox. So again, the platysmal muscle is this thin band-like muscle that goes across the neck. And over time, a very strong platysmal muscle can occur where you get hypertrophied bands, and which causes, it has the appearance of an aged neck. So those strong platysmal muscles cause these vertical neck bands that we're able to inject with Botox to relax it. It makes a big difference, as you see here in the before and after photo. Another reason to relax that muscle is that the platysmal muscle can pull down on facial skin. We talked about how it can interdigitate with some of the muscles on the lower face and pull down on skin and soft tissue, contributing to that blending of a jaw and neck and taking away a distinctly separate jaw and neck. So we do see those aesthetic improvements. And then we'll switch gears and talk about dermal fillers. So injectable fillers we can use to improve that scaffolding issue where the structures underlying the skin have lost volume. And so the fillers can replace that volume loss, and we use them to improve facial proportion. And we use them in young patients often as well for those that want to augment the face in one way or the other, even before some signs of aging have set in. Various materials are used. The most common and my favorite is hyaluronic acid. Hyaluronic acid is a molecule that occurs naturally in the body. We use it. It binds 1,000 times its weight in water and works very, very nicely as a dermal filler. It's also very easily dissolved if necessary for any various reasons. So dermal fillers come in variable densities. We can use a very delicate filler to replace areas of soft tissue, for example, under the eyes, nasolabial folds, areas where we want the soft tissue to be mimicked. And then we also can use a very dense filler, like something like Voluma, to help replace bony losses. So we'll use some, those thicker density fillers along the cheek, along the jawline, in the chin. We can even inject in the nose. And these have variable durations. So some last anywhere from 8 to 13 months and up. Coming down the line, we may even have some fillers that are lasting longer, but soon to be approved. We have those already in the EU. Minimal to no pain. So when you come in for a dermal filler procedure, usually we'll apply some topical numbing that'll stay on for about 30 minutes or so. We remove the anesthetic, prep the skin by cleaning it, and then just a few little pokes to inject the filler. And we can do that with just a teeny tiny little needle, or we can use a cannula that, if you imagine it's sort of like a blunt tip straw. In some areas, we can very safely inject filler through a cannula. And minimal downtime. There's a potential for some bruising and mild swelling, but that is, very typical. And sometimes patients leave not a bruise at all. And here's one of my patients we treated with just Voluma. So she was complaining about some mild jowling that came. She said that her mother has that and she wanted to prevent it from worsening and improve the appearance. And so what I did here was I took some Voluma, again, very dense filler, added just a little bit to the chin, a little bit along, right along the sort of the width of the chin where the jowl is forming. And then importantly, added some volume to the back of the mandible here on the back of the jaw, and just the littlest bit on the cheek as well. All of this helps to lift and replace that volume loss, and you see the improvement in the angle of the jaw. She also, if you notice redness, we actually treated with a Fraxel laser right before. So that's what that is. And just highlighting that we can often do, multiple procedures in one. And then here is a patient, a male patient, of course, and you can see between the before and after, we have injected, this is not one of my patients, but he's been injected with some filler along the jawline that helped to create that stronger jawline. You see a more well-defined jawline, which creates more of that masculine effect. And then another place we can use filler, this was a Bellatero, a very gentle, delicate filler that was used to correct her horizontal bandings, and so giving the appearance of a more youthful neck there. And then just to touch on thread lifts, so we can tighten with thread lifts. What these are is we use special surgical thread or suture material. There are a few kinds. One is PDO or polydiaxanone, and PLLA or polylactic acid. These suture materials and sort of placed through an injection and then lifted up, the goal being to lift that tissue. And then the material stimulates, they're sort of biostimulators. They stimulate collagen to form in those treatment areas. Results are seen after a few months and can usually last about 2 years, maybe up to 3. The sutures themselves will dissolve within a few months, but that material is there until it dissolves on its own. This is a better treatment for those with thicker skin. So a thinner skin may actually be unable to hide that suture. So you'll see some lines in there, which would be unwanted. So not everyone would be a candidate for this, just similar to all the procedures we're talking about. And then just a little bit on comfort during the procedure. So we want our patients to be comfortable. We have different ways of doing that. Topical anesthetic is used very often. We put either an anesthetic ointment or cream onto the skin, usually containing lidocaine, and leaving those on for anywhere from 30 minutes to an hour makes a world of difference in a lot of these procedures. Certain procedures we can use some injectable anesthetic too. Sometimes we will use that if we're using sort of a cannula, maybe to inject the jawline with some filler. We can just do a little poke of injectable anesthetic and makes that procedure very comfortable. Pronox is another thing we offer. It's a mix of nitrous oxide and oxygen. It's better than the old traditional laughing gas, but works very similarly and that you would have seen in the dentist office. And then we have a Zimmer or other cooling devices that can help sort of trick the discomfort. All right, so let's switch gears now and talk about what I'm calling the fat fighters, Kybella and CoolSculpting. So Kybella is a really neat product. This is deoxycholic acid. Deoxycholic acid is a bile acid. We, we use bile acids in our body to break down fat in consuming. So, or in the normal metabolism of fat in our bodies. And deoxycholic acid has been synthetically made so that we can actually inject it and break down fat tissue very safely. The treatment is very, very quick. After the topical numbing medicine is applied, that comes off. We inject some numbing medicine to make sure that you're comfortable during the procedure. And then the injections of the deoxycholic acid themselves, very quick, less than 5 minutes. And usually 2 or more treatments are required. I've seen incredible results, as I'll show you just after 2 treatments, but somewhere between 2 to 3 generally. And we would do those 4 to 6 weeks apart. The downtime, you have temporary discomfort, often some bruising, some significant swelling. A good time to do this treatment is often maybe in the fall or winter, where you can cover up with a scarf. No one knows what's under there. And some temporary numbness can occur in the treatment site as well. But it does a very, very nice job of decreasing the fullness and unwanted fat in this area. Originally got FDA approval for what's called the submental fat, or that fat sort of underneath the chin and around the neck area. And And Kybella is wonderful because it actually can induce a tightening effect on the treated area. So we get rid of some fullness and cause a little bit of tightening there. And here is one of my patients that was treated. This is 1 month after 2 treatments with Kybella, and she has a significant improvement of that cervical mental angle and a much more youthful appearance to the neck and jawline there. And this was just Kybella. And here's another patient. Again, you see the decrease in that submental fullness, making a much more youthful jawline and neck contour. And then the other fat fighter we'll talk about is CoolSculpting. So CoolSculpting is this great device that freezes and destroys about 20 to 30% of the treated fat cells each treatment. Sometimes only 1 treatment is needed. You can always do more if necessary. The device causes a targeted cooling that eliminates that unwanted fat. About 45 minutes per treatment, so a little, on the longer side per treatment versus Kybella. And what the cups are these applicator devices that you see here at the bottom of the screen. We can either use, depending on the anatomy and the fat tissue that we're treating, we can either do 1 or sometimes even 2 cups per treatment session. So if we were doing the 2 cups, say using 1, I don't know if you all can see me, but 1 on the one side, 1 on another, and that would be about an hour and a half of treatment because it would be 45 per cup. Minimal downtime. Again, you can get some numbness after the procedure, very mild swelling, not as much swelling as you would see with the Kybella typically. And then again, both of these devices, or both of these procedures you can have some bruising afterwards. Here is a patient that underwent CoolSculpting. You see similar results on the Kybella, decrease of that submental fullness and an improvement in that cervical mental angle. And I just want to talk a little bit about the importance of an expert consultation. So we can talk to you all about these devices and procedures, but truly coming into the office and letting someone take a look can really help. We can help determine what is your underlying issue, and helping you to meet your aesthetic goals. So you can have issues with excess fat tissue. You can have issues of muscles pulling down on the lower face. So maybe, I've had patients come in concerned about their fullness, thinking they would, want to do a CoolSculpting, say, but it turns out that there's also some muscles pulling down on the face that are causing some problems. And maybe there's some skin laxity that once we remove some of that fullness, it could actually, worsen the skin laxity. So sometimes using different treatment modalities in combination is the answer for that. But that's something that, of course, your provider can help guide you with. And then again, sometimes we need to correct the scaffolding, so that bone loss or just those genetic anatomic variations that may have been there since youth. And of the procedures and devices that we're talking about, most are very highly provider dependent. So, I have patients sometimes come in and say, oh, I've heard this device doesn't work, or I've heard this procedure has poor results. But truly, a lot of these are really dependent on the provider. Here at Laser Skin Surgery, the physicians or the MDs perform all of the procedures. Even CoolSculpting application is done by the providers. So that can help. You really want to make sure you have somebody that knows the anatomy very well, is an expert in these and well trained, so that you get the best results and increase the safety and optimize the safety and reduce your risks. And so we have many excellent treatment options like we talked about, and maybe a combination will yield the greatest result. So with that, I will turn it back over to Risa and see if we can answer any questions.
Great, that was amazing. Thank you so much, Dr. Murphy-Rose. A ton of great information. And yes, we have lots of questions. So before we get going to the questions, I just wanted to remind everyone this is the time to go into the Q&A feature, and any questions you may have, Dr. Murphy is now available. So let's get started. All right, big question. I'm sure a lot of people are wondering, how much does Sofwave cost and how many treatments does one need?
So Sofwave, it depends on the area. We can actually treat not only the face, the neck, we can treat arms, belly. I've had patients come in interested in treating, say, laxity after significant weight loss or after, pregnancy and so forth. So it depends on the treatment area. For the face, I believe it's 3,000. The neck is 4,500. A lot of times patients are coming in treating the face and the neck, and there's a reduction if you're treating the two places at once.
And of course, the prices are subject to change since this webinar
that's
is recorded. I don't want someone watching this 5 years from now.
Yes, if you have any specific questions about pricing, also just call into the office and someone will be able to help you.
Great, thank you. So, all right, here's another great question. What if I have one neck band that won't go away with Botox? Are there any other options?
Well, first, we need to make sure that that is indeed a neck band from the platysmal muscle. There are many other, well, not many, but there are a few other things that could cause it. And if it is the platysmal muscle and you're not responding to Botox, there are other neuromodulators to try, things like Dysport or Xeomin. Very rarely, but occasionally, people don't respond as well to one or the other. Usually they're pretty interchangeable, but that would be something to consider. And we'd have to see you in person to know for sure.
Got it. All right. Do you have a preference on neck creams? Your favorite, and do they work?
Well, the best answer to that question is the ingredients to look for. So, and topical treatments can help. They're not going to get you the same results as, say, a Sofwave tightening or one of these procedures. But things to look for: retinol is a very good, retinol or the retinoids, they're all in this vitamin A derived family. They help to stimulate collagen. Again, not to the level that some of these procedures like we talked about, but these certainly can make a difference. In fact, most dermatologists do use a retinol or a retinoid in their nightly skincare routine. Other things to look for are ingredients that are antioxidants. Antioxidants are going to help to treat and also prevent the signs of aging that we have. A lot of that's from sun damage, but other sort of environmental exposures that can contribute to aging of the skin and loss of collagen. So things like vitamin C, that's one of the most potent topical antioxidants that is available. So look for a neck cream that has that, and then also rich moisturizers, things like ceramides, and that'll help to replenish and replace the skin barrier, and other occlusive ingredients that will really moisturize. And just that moisture in the skin can help to create more of a suppleness and even decrease some teeny little fine lines too.
Great. And we do sell these in our practice in both Southampton and Manhattan. Also on our website, we have an online skincare store, and there is a section you can kind of narrow down to look at neck creams. So if you prefer to shop online, you can see there as well. All right. So here's another question. Do collagen powders do anything?
Collagen powders. So you're probably talking about collagen powders that you ingest. And the thought is that they may, in short, they may help, they can't hurt. But for the collagen to get back to your skin, you need to ingest it. It's going to be these little collagen protein peptides or protein fragments are going into your belly. They are going to be broken down. They have to get back into the bloodstream and then be delivered to the skin where you want it. So eating a well-balanced diet is probably more important than ingesting collagen, but there have been a lot of there's a lot of anecdotal evidence in some small clinical trials that have suggested that ingesting collagen may help the skin. So.
All right.
And don't be fooled by topical collagen, because collagen, the protein, cannot get in through your skin. So the marketers they're out there trying to get you to use collagen topically, but that's not really going to do anything for you.
All right. And the follow-up question to this is, how about peptides? Matrixly, I think.
Yeah, Matrix pretend, yes. So, now these are probably work better topically because you are going to be able, they're of a size that they can get into the body. They can penetrate, they penetrate the skin. And there have been some good clinical studies on these. Again, most of these studies are pretty small. Sometimes they're only performed by, the skincare company that is touting it, but there has been some good information for those, some good data, I should say, coming from that.
Okay, great. So we have a lot of great questions coming in, but before we go too much further, a lot of people are asking, are you taking new patients? Are you available for consultations? And how much do you charge for a consultation? How does that work?
Of course, absolutely. And I would love to meet you in person. If I do, please tell me that you saw this webinar. The cost, I don't really remember. Call the office.
I'll see if I can get it right now. But yes, Dr. Murphy-Rose is available for consultations in both our Manhattan and our Southampton location.
And while we're on that, if most people should be getting a skin check, a skin cancer screening once a year. Some people with increased risk factors should be doing them even more frequently. We see some patients, up to 4 times a year. So absolutely come in for that as well.
Okay, so back to Sofwave for neck and jawline contouring. Is any of this covered by insurance?
No, unfortunately, not that they know of. That question comes up all the time for all different procedures and lasers that we have. And yeah, they just consider it cosmetic.
All right. So how about, can software and filler both be used? And can you do them in the same treatment, or do you space them apart?
Absolutely. And I've done this many times with patients. We would probably treat with Sofwave first and then do the filler right afterwards. Absolutely. Great question.
Okay, great. And how about, so you do use Juvederm, or do you use Juvederm as a question, and how long does it usually last?
Yeah, so the Juvederm products, there are a few different ones. They usually, the easy answer is to say about a year. Everybody metabolizes them a little bit differently, and depending on the density of the specific type of Juvederm, there can be slight variations. But yes, I love Juvederm.
Great. All right. So what do you think is more effective, Sofwave or Ultherapy?
It's a good question. The reality is it's probably pretty comparable. And given that the results are similar, I myself would go for a Sofwave because you've got less downtime, less risk, slight less risk in the procedure, and very good results, no downtime, more comfortable because we're not treating as deep as you do with an Ultherapy procedure.
Yeah, but it's one of the best parts about the Laser Skin Surgery Center is because since we have both devices, when you come in, we can make sure, Dr. Murphy-Rose or whoever you see will evaluate you, and we have options because they're both there. So whatever's going to work best for you. So, all right, I did get an answer to the consultation question. So the consultations are $400 and they do go towards the treatments that you want to do. So it's definitely well worth it. All right. So how long does Botox on the neck last? And approximately, do you know what it costs to do that area, the bands?
Great question. And I should have touched on that. So like we talked about, starts working at 3 days. It's got at its full effect at 1 to 2 weeks. Mm-hmm. And then it usually lasts about 4 months, anywhere from 3 to 6 months for most patients. And what was was there another part to that question?
And how much does Botox normally cost for this area? I mean, is it similar to when someone's getting their forehead lines?
It's the same. So it's priced by the unit, $25 per unit. And it really just depends on your anatomy and how many units. So easier to answer that question when we see you in person, starting around 1,000.
Okay. And so all these treatments that you showed us today, once you do them and you look great, then what does maintenance look like? Do you have to come back annually for touch-ups, or what does that look like?
Sure. It just depends on, there's big variations. So like we said, Botox lasts about 4 months. Most patients are getting that treatment done, anywhere from like 3 to 4 times a year. Fillers can last about a year. The ultrasound devices, the results are usually about a year. I know many dermatologists that are doing an ultrasound tightening once a year, but not necessary. So, if you want to sustain the results of like a Botox, say, you would have to continue doing the procedures. Fillers last about a year. I've had patients come back even having, say under eye filler that was still definitely working, a year and a half or 2 years, even longer. So really hard to say. And then with, for example, like a laser resurfacing treatment, your skin and a lot of the devices that are going to stimulate collagen production, you keep getting improvements even up to a year or so. So, the specific device definitely matters in that question.
Okay. So do you find that CoolSculpting for the chin fat can also help tighten the skin?
Cool. That's one of the benefits to Kybella over CoolSculpting. With CoolSculpting, we don't really see that tightening. With Kybella, we do.
Interesting. Okay, here's a great question. If I'm looking to drop 15 pounds still, so I still have some fat, is CoolSculpting an option?
Absolutely. In fact, a lot of patients that will lose weight will not lose weight in this stubborn submental area. So I think probably the best way to think of that would be if you can recall the last time you were at that target weight, how did the anatomy look? And if you did not have that fullness, then perhaps losing that 15 pounds is really all you need. And if you can think back or look back at photos and say, well, hey, when I was 15 pounds lighter, I still had that, then absolutely, one of the procedures would probably be a good idea. And you could do it, before losing the
weight. Great. Okay, we still have a few more questions. So guys, keep staying. There's still good questions coming. Yeah. How long do the effects of Sofwave last?
Sofwave is thought to last about a year, but really it's a very new device, and it may be that those results are sustained much longer. We just don't have the data on it yet.
Okay. And if you have metal dental fillings in your mouth, does that mean you cannot have Sofwave?
I don't believe so. It's just ultrasound. So there may be something I don't know, but I don't think so.
Okay. All right. Let's see. Okay, this one says, I realize this is a difficult question to answer without seeing the patient, but what would be your typical combination of recommendations for a 60-year-old woman concerned about jowls and her lower face and neck?
So it's a great question. I'm sure many people watching this webinar are asking it, but it's really sort of that thing that I was touching on where it's very hard to say just, like you're saying, Risa, just by hearing that, because there are certain anatomical differences that may be subtle, but that, to an expert or to a dermatologist can look at it and say, oh, this is really what you need. So I would encourage you, if you can, to come in and see us, or if you're out of state, see a very well reputable dermatologist to help answer that question.
Yeah. And also I'll just add that, at our office, beyond our 16 board certified dermatologists, we also have 2 board certified plastic surgeons. So if for any reason, Dr. Murphy-Rose or any of our dermatologists feels that you do need surgery, of course we do offer neck lifts and facelifts if that is, a more appropriate treatment option or something.
Absolutely. And thank you for saying that. I did mean to mention that these devices are the non-surgical devices. Mm-hmm. That's what we are focusing on today. But with, severe laxity, really many patients will be a surgical candidate, and our plastic surgeons are excellent, where they can actually truly get in there, move the tissue, move the muscle, move the skin, take out redundancy, and make a big improvement. These are more geared for patients with either, just mild or moderate laxity, or changes that can be, corrected with some of the injectables or the devices, or someone who maybe doesn't want to go under the knife, or doesn't want to have one of the more invasive procedures, or for any maybe health issues, health reasons, they're not a surgical candidate.
Got it. So maybe someone like me, I'm not super young, but I'm still younger. So if I start getting these treatments now, I might be able to prolong, or, maybe eventually not need surgery if I keep up. Would that be a fair statement?
Absolutely. I mean, we are all losing that collagen about 1% a year. And the bony resorption is occurring, the fat pads are moving, and there's not a whole lot we can do other than, good sun protection, avoid bad habits like smoking, stay hydrated, maintain a good diet, reduce your stress as much as possible, exercise, all that good stuff.
Reminding me to drink water. Thank you.
Yeah.
All right. So a few more questions that this brought up that are off of the neck and jawline, but still related. So Kybella, can it also be used on knee fat?
Absolutely. Yeah, it's a great area for it. Kybella is a really fun treatment because we can use it in all different places, and we can very precisely inject the medication right where we want it.
So what are some of those other body areas so we can all start thinking about where we might
raw fat is one of the areas, kind of the area on the upper back there, or kind of around the underarm area.
The part that pops out over the bathing suit.
Yes, we can use it, a good amount of Kybella around the belly area, love handles, the flanks, that sort of thing. We can really use it in a good number of spots. And I just encourage you to talk to your dermatologist, because there are a few limitations to that, but there are a good number of fat pockets we can target.
I love to hear that. All right, so let's talk about lasers. So can a laser remove freckles on my legs and my arms?
Absolutely. Yeah, we didn't talk about any of that in this webinar, but we've got all the tools. And one of the best parts about joining this wonderful practice was that we really do have every possible treatment option available to us. So, your doctor can talk to you all about those.
Over 100 lasers to be exact. So in your opinion, what is the best laser to get rid of chest and face freckles and melasma?
There are a bunch, and it just depends on several factors. Where is the pigment in your skin? Is it very superficial? Is it just underneath? And that's something that your doctor can help to determine what is, your skin type. Darker skin types may not be good candidates for certain lasers that can target not only the unwanted pigment, but also the wanted pigment. There's several, multifactorial, but we've got every tool available to do it.
Got it. All right. So I know a lot of the before and after photos show women, and we're both women talking about this, but do you have men coming in for these neck and jawline treatments as well?
Absolutely. Yes. No gender discrimination, nothing like that. Really, we do see a lot of both men and women for really every procedure. And maybe I would even say over the several years that I've been in practice, I've seen more and more men over the years for whatever reason.
Yeah, I think it's just not as much like in the media yet, but behind the scenes.
Yeah, I would agree.
More. All right. So do you use a grid for Kybella, and is Kybella carcinogenic?
I do use a grid. Sometimes, depending on the treatment area, I will create my own grid, but sometimes I will use the temporary tattoo grid that comes with it. And one of the things I like about Kybella is you can sort of use your own artistic eye with it, and you can even sort of feather out the Kybella so we can treat certain areas with a certain amount. We can start to taper it out a little bit just based on your need. But and then as far as remind me, the other part of that question was
what was I saying? Is it carcinogenic?
Carcinogenic, yes. Not that I know of, no.
Okay, great. So let's see, last few questions.
In fact, and just to touch on that, it's a bile acid that occurs naturally in the body. We use it to break down fat in our bodies in normal metabolism, so unlikely.
So what is the best treatment for above the lip that doesn't give you a frozen look like so many celebrities have?
What is the concern there?
I don't know. They said treatment for above the lip. Okay, so the person that wrote that.
Maybe this is about Botox or probably about a Botox kind of a thing,
or filler.
Maybe a filler. Well, I'll just say that any of these things that we talked about, whether it's an injectable or a device or a procedure, if done in the wrong hands, you can get, really poor results. So, like I mentioned before, very important that you're going to someone reputable, that has really a good amount of, experience. They've done a lot of years of training on anatomy and have a nice aesthetic eye to be able to get you the best results and to do so the safest way possible.
Got it. All right.
The best results go unnoticed. So if you, I hear patients all the time, or even if I'm at a party and someone wants to talk derm, one of the questions or one of the concerns a lot of times is, hey, I really wish I could do this, but I don't want to because I've seen it and I've seen awful results. It looks really unnatural. Well, if you saw that it looked unnatural, it probably just wasn't done well.
Yeah. And all the people that do look natural had it done well. It's not that they didn't have something done. Okay, great. So someone else is asking if we offer payment plans for neck and jawline contouring, and I can help answer that. Yes, we do. We work with a couple different vendors, including Care Credit. They have online applications, and depending on your credit, sometimes it's even up to 0% interest, for the first 12 months, for example. So there's definitely great options. And how can I make an appointment? Well, you can call the office tomorrow morning when we open up in business hours, or you can go on our website right now and there's a contact form. You can click to request an appointment and you can specify if you'd like to, see Dr. Murphy-Rose, and we'd love to get you in as quickly as possible. I know we're booking out fast now, through the fall. So definitely get yourself scheduled as soon as possible.
Come see me or any of our wonderful colleagues.
Yes, we would love to see you. So anyways, if we didn't get to all of your questions, I apologize, but please, you're welcome to send more questions on our Instagram or on our website contact form. And of course, having a consultation, we would love to meet you in person. Dr. Murphy-Rose is an amazing new dermatologist that joined our practice with all of our amazing physicians. So we'd love to meet every single one of you and hopefully help us all get that beautiful neck and jawline that we want. We see in all those pictures you showed in the beginning. So any final words, Dr. Murphy-Rose?
No, that's it. I hope you all enjoyed and got some information about it. Our website also has good a deal of information, some more before and afters too. So be sure to check that out if you have any other questions.
Great. And we'll be emailing you all this recording so you can watch it again, and feel free to share it with any family or friends that might also be, getting any useful education from this webinar. So thank you so much, Dr. Murphy-Rose, for your time this evening and sharing all this great knowledge. And I really hope that it can help some of you that tuned in to watch. Have a great evening. Bye.
Bye-bye.